let's talk about subchorionic hemorrhage or hematoma. Both ways to say the same thing. This is bleeding that is very common in the first trimester. In fact, about 20% of pregnancies will have bleeding from subchorionic hemorrhages. And in IVF, I've heard some IVF clinics say as many as 50% of their pregnancies after fertility treatments will have this kind of bleeding in the first trimester. Now, it's something that we don't talk about as much as we should. We don't hear about it until we have it happen to us, and then all of a sudden we start hearing about everybody's story. So let's talk about it. The first thing to know is that when you see blood, yes, it's terrifying, but you need to know that it's not necessarily a miscarriage. In fact, a lot of times these pregnancies will progress. We'll talk about why in a second. So it can be a big gush of red blood to a tiny little bit of brown spotting or anything in between, but it is not necessarily the end of a pregnancy. It might be a miscarriage, but it also might not be. You have to investigate more and wait and spend more time before you'll really know. So it's helpful to think of your uterus like the inside of a slightly inflated birthday balloon. Now, the entire inside of this space has lining and has tissue in it. And the truth is that implantation and the pregnancy are going to implant and start in one small area. And the bleeding can come from all the other areas around it. And as long as it doesn't detach that implantation, that spot where pregnancy is attached to the blood vessels, the pregnancy can continue to progress. There can be a lot of blood coming from all these other areas. It can look like quite a lot, but it doesn't mean that there's necessarily a detachment of the pregnancy fully, which is a good thing. The main thing that I have my acupuncture patients do when this happens is advocate. Ask for an ultrasound, ask to be checked out, ask for someone to look and see if they can see where this blood is coming from, how much of it is still there, how much they could expect might still need to work its way out. And this needs to be done at a clinic with an ultrasound. Also, it's helpful to know that if a subchorionic hemorrhage resolves and heals before the end of the first trimester, the prognosis is extra good. Now, sometimes you go in for an ultrasound and they can't necessarily see where the bleeding was coming from and everything looks okay. That's still worth it, usually, the cost of the ultrasound, just from a mental health perspective. But it's also important to remember that bleeding can happen in pregnancy for other reasons, especially if you're using suppositories, which is often the case in IVF. That suppository going in and out can irritate the vagina, and the bleeding might be coming from there, or irritating the cervix, and the bleeding might be coming from there. So if they can't see anything in the uterus, this is possibly the case. Now, you might be asking yourself, so what causes these? We know there are certain risk factors, including IVF, that make these more likely to happen, but it's still debatable what's happening first. So there's not one consensus. So different camps say that there's a bleed first, and then there's coagulation and a clot, and then some people think there's a clot first, and the bleed is trying to push it out. And so depending on what mindset your practitioner's in, they might have different recommendations. So baby aspirin, for example, is a mild blood thinner. If there was a bleed first, that blood thinner might make that worse. But if there was a clot first, that blood thinner might help that resolve. Because we don't know, and maybe there's some of both, and we can't really tell, it kind of depends on what your practitioner believes and what they see and what their best gut instinct is as far as recommendations go for what to do. There's also one very small study on something called alpha lipoic acid, ALA, that may help subchorionic hemorrhages resolve faster, heal faster. Some clinics will say that this is a good thing to take, others will not, because it is such a small study. The main thing is you'd want to talk to your practitioner and have them look at your situation and make their best educated guess. I think it's probably always a good idea, especially if it's red, fresh blood, more blood coming out, to take it easy and to let it kind of get situated and settle a little bit. So I think pelvic rest at the very least is a good idea. So that's not lifting anything heavy, not doing things like crunches and things that will increase abdominal pelvic pressure, not doing any sort of penetrative vaginal things unless you have suppositories and your doctor tells you to keep doing them. Make sure that you double check on that one and don't don't just stop any medications, because those can be really important. So you want to have a conversation again and know what you're doing and why. But I think taking it a little bit easy, just putting your feet up a little bit more is a good idea, especially when it's that fresh red blood. Remember, breathing is never a bad idea. I have meditations on my YouTube channel that you could check out. I also have acupressure videos that are for when you're panicked. So the heart centering video, the fertility freak out ear acupressure videos are all really good for if you're feeling panicked. Take 3 deep breaths. If you start panicking, do it again. Just keep doing it and get through moment to moment. Advocate. Ask for somebody to take a look. Ask for somebody to give you customized guidance. Remember, I'm out in the world thinking of you, cheering you on. I hope that your bleed does resolve okay and that it's not the end of your pregnancy. And I'll definitely be thinking of you out in the world.